Hello everyone, today we're going to talk about the secret to a quick and dirty gait analysis. And you've probably been in this situation before. You found yourself wanting something that you don't have. And whether that's professionally or personally, it happens all the time. I can think of a couple examples. One might be you're a young PT or a young clinic owner or new at a new clinic and you may not have a treadmill or you may not have a lot of space. Or you might be a PT that works in the home health setting. Or you might be an inpatient PT. Whatever the case may be, we don't always have everything that we want. We don't always have the resources we might want for a great gait analysis. But there's a lot we can still offer for our patients. Because what's the flip side? Do we tell patients, no, we just can't help you. We don't have these ideal conditions. We can't do anything for you. No, that's not what we want to do. Patients will go look for the information elsewhere, oftentimes places that don't have as good of information or follow evidence-based practice. So what do? Well, there's a lot we can offer. There's a lot of things we can do to help our patients. And a lot of it is being able to simplify our gait analyses into a simple, quick, and dirty gait analysis. This can be both for running and for walking, and there's a lot of applications you can have. However, there's some important aspects. We want to make sure we have the best setup we possibly can, simplified, and we also want to make sure we're acknowledging what we can do and what maybe we should stay away from. Let's get into some of the details. So for the gait analysis setup, we first need to get some assumptions out of the way. And that is that your patient can walk or run. And I know sometimes I'll get comments saying, well, if this patient couldn't walk, I couldn't do a gait analysis. Well, it's a little hard to do a gait analysis on a patient that can't walk. So that's an assumption we need to make. Also, we need to make an assumption that there is some space available around you. For example, if you have a small clinic, maybe you have a sidewalk outside or a street outside that you can use. So you want something that's unobstructed for approximately 50 feet. And then lastly, the assumption that we're making is that you, the PT, has access to a smartphone. And that smartphone obviously should have a camera to it. So those are some of the assumptions that we're making here. Now, that is most of us that has that situation, but if you don't, I'll tell you what. Email me, send me a message, say, hey, this is my situation. I don't have all those assumptions. Is there anything I can do? I bet we can figure out something that you can do for your patient. So let's talk about a gait setup for your gait analysis. So first, you want to make sure you have some stickers. That's the last thing that you'll need. A smartphone, stickers, and a patient, a subject you can work on. Maybe a walking or running gait analysis. So first, set up your subject or your patient with stickers on them to mark their anatomical locations. Here's the anatomical locations that you want to make sure you identify. The lateral malleolus, fibular head, greater trochanter, posterior calcaneus, and PSIS. Now, once you have those anatomical locations marked, you want to make sure that you're giving your patient some time to warm up. So have them start with a slow walk, and if it's a walking gait analysis, make sure after a couple minutes, 3 to 5, that they can walk comfortably at a normal pace. Or if it's a running gait analysis, make sure that they can run comfortably after about 3 to 5 minutes. At the end of the warm-up, whatever it is, no matter how long it takes, it shouldn't be shorter than 3 minutes, they should be able to hold their normal pace comfortably. Once the patient is ready to go, you need to find a location. So let's say you went outside, you're using the flattest street you could possibly find or a good place in the clinic. So you want to pick the posterior view and the lateral view. And you want to make sure that the angles that you're going to capture are going to hold the patient in the frame the whole time. So from the posterior view, I would suggest to kneel down, get into a position you can hold the camera as stable as possible, use that slow motion feature, and video the patient walking or running away and back towards you. From the lateral view, sometimes it's a little trickier because sometimes we can't get the patient's full distance in the screen or in the shot. What I'd recommend is that you capture anywhere from halfway through their distance to 3/4 of the way through the distance. That will give you the best opportunity to catch them during normal striding and normal running gait. So give extra careful consideration to that lateral view, and then make sure that you're, again, holding that camera stable. You don't have a stand, you don't have a tripod, you don't have anything to keep it stable. Make sure you're doing something to make it as stable as possible. So once you get the 2 videos, now it's time to do the analysis part. So you use that slow motion feature on your videos, and you slow it down and you go through and you look at what their running form looks like. And there's a couple important things that you want to note. First off, you want to try to analyze the times that they look like they're running typically or at their normal speed. And that's going to be hard, especially if you have a limited distance, they have to turn around halfway through. You're going to have to be a little bit choosy about what part of their gait analysis you actually analyze. Again, this is a really simple, a really quick and dirty gait analysis. We're doing the best job we can with limited resources, so we're doing the best job we can to be able to identify what looks like normal gait. And we're going to use those stickers that you placed before to make sure you're looking at the right area. Use the zoom feature on your phone or on the smart device you're using to make sure you can identify these different areas. Here's the things I want you to look for. So from the lateral view, look for a couple things. One of them is the foot strike. Are they landing forefoot, midfoot, rear foot? You're probably not going to be able to use gait analysis equipment to be able to calculate the specific angle. However, you can always tell, hey, is that a really excessive heel strike, midfoot strike, forefoot strike? What's the knee joint angle at initial contact, mid stance, swing? Is there excessive flexion or hyperextension? What's the femoral position at initial contact? Is the patient overstriding? And what's it at terminal hip extension? For example, is terminal hip extension limited or potentially excessive? Look at their pelvic tilt, whether it's anterior, posterior, or neutral. Trunk lean, whether it's anterior, posterior, or neutral again. And then on the posterior view, we want to look for foot strike. Again, we want to see if the width, if the feet are actually crossing over each other, how wide apart the feet are. The foot progression angle, if there's overpronation or if there's excessive supination. We also want to look at genu valgum, genu varus during stance, hip drop, and trunk lateral lean or rotation. Now there's a ton of other things that we can look for. However, this is probably the highest value to look at and to analyze. And again, we are looking at those things to be able to identify the major things that are going on, the most common things that are going on, which segues me into my next point. What you want to look for on their running gait or walking gait analysis is not just one lap of them going through the distance that you ask them to go through. You want to look at several laps. So get the analysis for 1 lap, 2 laps, 3 laps, because that's what's going to help to mitigate any irregularities the patient has on that one trip back and forth, and it's going to help you mitigate just some abnormalities that you might find. Also, the important part is going to be to make sure you're analyzing, again, their typical gait pattern. So when they just start to get up to speed after they turn, not a great time to really make a lot of assessment. However, halfway through that stride, when they're getting to more of their normal gait, then you can kind of bank on the fact that, okay, that's what they look like when they're running or walking outside. So lastly, what really is the secret to a quick and dirty gait analysis? Well, there's not just one of them. There's many different secrets. But the secret is to take the most common themes you find from your runner or walker. Make sure you're taking the major deviations. So for example, if the patient is landing and during stance they have genu valgum and they also are reporting signs and symptoms of patellofemoral pain syndrome. And of course, go back and listen to our episode that talks all about how we resolved a patient's patellofemoral pain syndrome with one running gait analysis. But if you're finding those positive findings and you're seeing it every single lap and it's a major finding, that's a pretty good bet that you can address that genu valgum, that it's going to help them, and that that's a safe thing to do for that patient. Whereas maybe you see one example of overpronation for the patient when they land, but you don't see it a lot. Well, that might not be a safe bet because they're not doing it consistently, but also because it may not be something that's actually affecting them. So you want to be a bit choosy about what you actually analyze and what you pick to plan to make your plan of care of. So make sure to take the major things that are going on. Maybe it's hip drop, maybe it's Jenny valgum, maybe it's some forefoot external rotation, or maybe it's the fact that they're overstriding. Whatever it is, make sure to use the things that you see are most obvious. And you can also back up your running or walking gait analysis with range of motion measurements, or special tests, or manual muscle tests. And lastly, functional movement assessments, which are always great to do. So those things can all help your running gait analysis and walking gait analysis be really good. And it can make a very simple, quick and dirty gait analysis something that you can integrate into the patient's plan of care rather than speculating or just having them run maybe one lap and then thinking, well, maybe they do this, but I'm not sure. This is a great way to try to mitigate some of the information or lack of information you have. But obviously, quick and dirty gait analyses are great, but there's a lot of ways you can elevate your gait analysis. And some of that includes getting a treadmill or getting fancier equipment, getting really good cameras, or downloading software that can help you integrate into being able to analyze that person's running form or walking form. And especially for our running gait analyses, we have a lot of emergence of wearable technology that can be really, really advantageous to help you analyze people's gait. Now, of course, you're welcome to check out the Essentials of Running Gait Analysis Continuing Education course, which we have on solutionseducation.com, and that can help you get ready for a really good advanced running gait analysis. And the majority of attendees actually recover their investment within 2 running gait analyses, so usually they recover those costs pretty quickly. Now, if you do have any other questions about this content, or if there's anything else you were thinking about in terms of a quick and dirty gait analysis, please let us know. Drop us a comment, drop us an email, let us know, and we'll get back to you. Until then, I encourage you to get out there and do more gait analyses, and of course, we'll see you next time. Take care.